Good morning, everyone. My name is Ahmad, and I'm the co-founder of Hidiq. I would like to introduce you to Faye. Faye is someone that spends a lot of time on her laptop and on her smartphone. And recently, she's been struggling with pain in her wrist. Now, Faye hates going to the hospital. She doesn't like getting stuck in traffic, booking appointments, and sitting in queues. So she did what most of us would do. She went online and she decided to go on an adventure to try to figure out what's wrong with her and why she has this pain. After spending almost an hour reading through medical journals and texts and websites, she was shocked to find out that she had one of two conditions. She either had a rare disease in her hand and she had to chop it off, or she had cancer. Now, this revelation caused Faye to get an ulcer due to all of this anxiety. Now, the story of Faye is the story of all of us. We all hate going to the hospital whenever we have a non-urgent health issue. So, one of the reasons is in North America, for example, and in Europe and in the UK, the time to get an appointment with a doctor is 2 to 4 weeks. And the average time you spend in a hospital, in a waiting room, is between 60 to 90 minutes. And this is the average, and it's not right. Patients have access to data. They can go online and try to treat themselves, but the problem with that is it leads to anxiety. So what patients want is a doctor on demand, someone they could rely on when they have a non-urgent health issue. They want a tailored solution, they want tailored advice to the unique patients and unique human beings that they are. They want access to a highly qualified network of doctors that can help relieve the stress and this anxiety from them and help treat those conditions that they're struggling with, and they want to save time. So what we're looking at is we need a patient-centered medicine, a patient-centric approach. And we've seen healthcare becoming more and more democratized. With patients' increased access to technology, they are able to manage their own healthcare. They're able to go online and try to treat themselves and understand what's going on. And when something goes wrong, they want to be able to get advice, when necessary, from a doctor, an expert. And mobile technology has become the center and the future of medicine. We, as patients, have now a voice in healthcare. Before, it was the doctor, the specialist, the consultant, the advisor was the person that would tell us what's wrong and we have to take it. Now, this relationship has become more and more equal, and patients have developed a voice in this sort of equal relationship where they can together go out for a treatment. We've seen this in different industries. Uber, the founder of Uber is not a cab driver. The founder of Airbnb is not a hotelier. And we've seen these kind of consumers and customers get more and more involved in all of these businesses or revolutions that we've seen happen, and help make them happen in collaboration with all the other parties. And cutting-edge technologies are no longer expensive. We all have amazing and extremely powerful technologies in our pockets, in our smartphones. And we see it in smartphones, wearable devices, apps, and sensors. And we've seen this kind of ecosystem build, growing in these different silos by themselves and slowly transforming into a healthcare and health tech ecosystem. This ecosystem is artificially intelligent. It can help the patient symptom check. It can help them get diagnosis and connect them to the right medical specialist. They are they're integrated with different wearable devices and diagnostic tools. They can help them track blood pressure. They can help them figure out what their weight is and how they've progressed over a period of time. There's even ECG managers that generate cardiograms that you can instantly share with a doctor. And you've got different diabetes management solutions and so many other sensors that can help the patient understand what's going on and share it instantly with the doctor. And this is all connected with their own profile, their own data that they want on board, And this data is theirs. They own it, and they want access to it at any point in time. And they're also looking at different ways where they can communicate with the doctor. So one concept is virtual reality treatment. So I can put on my headset, I can select the environment I want, put on the music I like, and then I'm transported to a hammock in Honolulu and have a chat with my therapist. And the end game is to then summon a doctor whenever necessary. And we've seen different approaches and different solutions coming towards this ecosystem and towards this approach. The evolution of healthcare and health tech started with products, towards services, solutions, and in this decade, we've seen real-time care, and the approach for the future is for preventative care through AI and robotics. So this is a graph from the book The Patient Will See You by Eric Topol, where he described the medicalized smartphone. And it's something that we're seeing happen. Patients are now more involved in their own healthcare through the devices that they have, and they have now more an equal sort of say in how to treat their issues and their symptoms and their health problems. But doctors are struggling. There's a challenge because they will be facing an immense amount of data coming to them, and it's overwhelming for them to process and analyze this data. So what needs to happen is we need AI and machine learning solutions, intelligent solutions that can help process this data. It can streamline and contextualize this data and send it across to the doctor. It can monitor the patients, send them preventive and notifications and tips and reminders about what's going on with them, and then notify the doctor whenever something wrong happens and ask them to intervene and provide the patient with instant care. Now, we're trying to do exactly that at HeyDoc. We're a global telemedicine platform, and what we're doing is we're working on different initiatives, but one initiative that we feel will help democratize healthcare even further is an initiative called Salamtak. Now, Salamtak, the aim of it is to provide a free, holistic, multilingual, private and secure platform that will connect people, disadvantaged people, in rural areas, in developing countries, and in refugee camps, help provide them with free healthcare access. And this goal has been really key for us over the past year. As we've seen from the MSF, there was over 10 million people that were forced to leave their homes due to persecution. That's over 28,000 people every day. In some countries in Africa, there's 14 doctors for every 1 million people. That's 14 doctors. There was over 4 million Syrian refugees in Jordan, Lebanon, and and Turkey. 20% of doctors are serving 72% of the population in India, in rural India. And we've all seen what's happened to Rohingya Muslims over the past year. We're very excited about the health tech evolution over the past 10 years, and hopefully you guys are too. Thank you very much.
Thank you, Ahmed, so much. And it's always fascinating how technology in general is revolutionizing healthcare. The more we adopt technology, the more it makes our lives much, much easier. Always a pleasure listening to you talk. Thank you so much.
Thank you.